Hi to all of you in Cape Town. I apologize that I couldn't make it to Cape Town, and I hope this short video is going to give you some inspirational ideas about collective leadership in healthcare systems that involve cross-sector, cross-institutional stakeholders. So when we look at collective leadership in cross-institutional healthcare, we need to think about the capacity of a collective. That's how we define it, a group of cross-institutional actors, and how they deliver their complementary contribution to a joint purpose that should be, in our case, improving the healthcare, and how they do it collaboratively, because this is most often a catalyzing change towards transformations. And this all relates back to our attempt to implement the Sustainable Development Goals. We do have number 3, good health, as one of the goals, but number 3 needs to be intrinsically connected to the goal number 17, the partnerships for the goals, because collaboration is the absolute key for collective leadership, and that is an essential ingredient for improving the quality of healthcare. So what do we mean by this? Looking at systemic well-being, at a holistic approach to involving different stakeholders in healthcare, means that we need to look beyond the individual institution. So in this short video, I'm talking about not the collective leadership within institutions, that is evenly important, but across institutions, because here we're talking about a network of change agents that actually work together to increase the effectiveness of healthcare. And this often requires to create a broader vision of well-being in which healthcare institutions contribute among other stakeholders to the overall health. So this has an effect then on the individual patient, but it also has an effect in the climate of how healthcare is being delivered. So, and that, in our view, in our experience, improves the effectiveness of healthcare. So that means we need to involve different stakeholders into what we call a collaboration ecosystems. There could be in a certain area traditional approaches to medicine, there could be alternative health practitioners, and that is looking at the different stakeholders that actually contribute to health. And that could be municipalities, community organizations, companies, NGOs, etc., and people particularly also who deliver social services. So this collective leadership in cross-institutional healthcare looks at how these people work together. At the Collective Leadership Institute, we have made really good experience by developing what we call a dialogic change model, because it is really about getting different stakeholders into a dialogue. And that means that one needs to look at building these collaboration ecosystems in healthcare in 4 distinct phases about exploring and engaging. In a phase 1, it's about building that system and formalizing the system agreements, how to work together. It is about implementing and also evaluating how do we do. And then it's about sustaining the impact. It's about developing it further. And that has made us really help people to build these collaboration ecosystems. And what came out quite clearly is that there are certain success factors that one needs to take care of in cross-institutional collaboration in order to arrive at a spirit of collective leadership, at a spirit of complementary contribution and a joint purpose and a joint success. And the first success factor is about fostering a sense of future possibilities. It's like thinking in possibilities. So we need to actually tap into stakeholders' desire to shape a better future. We need to look at empowering staff to take responsibility to also work beyond their own institutions. And we need to look at deciding on joint measurements for success. The second success factor is about engaging people in shaping their reality. And again, this means going beyond silos. That means working in networks and keep people connected, because that's often neglected in collaboration projects. and looking at what actually is the next level improvement that we can deliver together. And the third success factor is about encouraging innovation, because when people can bring in new ideas, then there is more fun, there is more like desire to really make a difference. And that includes to inspire a pride for quality, so that people can also see the progresses they made and the effect it has on people and on patients. And of course, we need to take mistakes as an opportunity to learn, particularly also in quality management. The success factor number 4 is cultivating humanness, and it seems that this should be the first success factors because it's often neglected, the ability of people to really connect with people, also across institutions. And this means we need to go on a listening journey. We need to foster mutual understanding, because the different institutions have different logics and different constraints, etc. And we need to look at how and in what way is the concern for the well-being of the area, of the community, of the people, of the patients relevant for all. Success factor number 5 is we really need to harvest the collective intelligence. So it means that we need to build dialogue structures that enhance mutual learnings, and I will give some examples later. And we need to look at making progress and successes transparent. It is about working across silos again and again, working across departments and working across institutions. And the last success factor is to foster a sense of wholeness, a sense of contributing to something really bigger. And this means keeping track of trends and developments. It's about enabling people to have to develop a culture of mutual support. And it's about cultivating a spirit of contribution to the well-being of people and community. So there are 2 examples that I would like to mention that are quite interesting. One is from Germany, the other one is from the Ukraine. And the example in Germany, it's quite an interesting area in northern Germany where there are not enough doctors. I don't want to say the healthcare delivery is compromised. However, compared to other areas, people need to drive long distances to get to doctors. And so there is a network that has been created, which is called HAFFNET. HAFFNET is the area close to the sea, between the islands, as you can see from the map. And currently the network has 45 doctors and practitioners. And the purpose of this network is to look at interdisciplinary medical cooperation to integrate the outpatient and inpatient care. And what is important is that this coordinated action leads to an increase of transfer of medical knowledge. They've made really good experience with that. And that in the end increases the quality of treatment. So it is really the purpose of the network is to improve medical care by combining the highest medical quality standards and the best knowledge with patient-centered treatment. So the other example is quite different. It's an example about collective leadership in the health sector in the Ukraine, where it is about decentralizing the healthcare in order to improve the quality. So here it is about strengthening individual and collective leadership and change management skills of people who support and promote and administer the health reform. So it is about really investing into the future generation of leaders and looking at the healthcare managers. So this is about creating a voluntary, more informal network that consists of healthcare professionals, of civil society activists, of representatives of provinces and local administration, so that they can own the improvement of the healthcare together, and that they can also make changes together and see, what is necessary. So it's about leadership training, it's about building networks, and it's about communication skills. And this works then in creating regular exchange meetings that are facilitated, and where people also learn to facilitate these meetings when they work kind of theme related working groups, etc. And the entire network would get a monthly update, and people would also be informed about the healthcare reform. So these are two quite different examples that show how the cross-institutional collective leadership approach is actually contributing to the quality of the healthcare. And why is collective leadership within and across institutions so important? So amazingly simple is it creates human connections, which is a core ingredient for well-being also in patient care. But it is about not being locked in your own institutions, about going beyond the institutions and looking at health in a more holistic way. It actually invigorates human competences as there is an exchange of knowledge, there is an exchange of viewpoints, and that is so essential for delivering quality and also being proud of delivering quality. And it also, and that is very, very important, shifts the pattern of behavior towards collective responsibility. So people go beyond their silos. They wouldn't say anymore, this is not my kettle of fish, this is not my responsibility, but they would look at how to do things collectively in a complementary action and with a spirit of mutually supporting each other. So in the end, this enhances the vitality and the resilience of the entire healthcare delivery system. And if then, of course, there's also collective leadership within health institutions, there is an additional brilliant mutual support. But the collective leadership skill beyond the institution, the cross-institutional cooperation, is evenly important to enable a spirit of collective leadership. So this is all based on a thorough research in what creates vitality and resilience in systems, and the vitality and resilience in systems actually also mirrors the need for vitality and resilience in the patient, in the individual person. So there is an intrinsic connections. This has been written up, the research, in a book called Stewarding Sustainability Transformations, published this year. And the book contains more examples. The focus is not on healthcare, because in so many other areas, kind of similarly collective leadership skills are needed. But that is a kind of background reading that I could recommend. So with that, I thank you very much for your attention, and I hope that you're having a great conference and many, many inspirational presentations and inspirational conversations. Thank you.